Hey guys, welcome to Sarah Has Questions. Today we're going to talk about stroke, and there's an acronym you need to know. It's called Be Fast. Every letter counts, and it'll let you know when it's time to call 911. Let's talk about it. I'm Sarah King, and I have a lot of questions. What exactly happens when you orgasm physically? Will popping a knuckle or a joint give us arthritis? What can we learn from our poop? The size of your body doesn't necessarily indicate your measure of health. Yes. And what are your thoughts on that? Cleansing. Do we need to do anything special to our nether regions? In this show, I get to ask all these questions to WakeMed doctors who happen to know everything about everything. Sarah Has Questions is a production of Capital Broadcasting Company and Mix 101.5. It's presented by WakeMed. So today we have Dr. Kalaria, who is a vascular neurologist and the medical stroke director at WakeMed here in Raleigh. Welcome.
Thank you for having me.
And today we're going to talk about women and stroke. I mean, strokes happen to men and to women, but it seems like they happen to women more. But before we get into that, let's just get to the very basics. What exactly is a stroke?
I'm really glad you started with that question because I found that a lot of patients use the word stroke a lot. It's used a lot in just common talk, but most people don't know what's happening to their body. So there are pipes that carry blood throughout our body to our brain as well, of course. And these pipes or blood vessels, if they can't get the blood where it needs to go, that's what a stroke is. So either you'll have a blocked pipe, which is called an ischemic stroke, or the pipe bursts. And that's called a hemorrhagic stroke. And that's a bleeding type stroke. And so that's what a stroke is, blood not reaching where it needs to go.
So can I have a stroke to my hand?
You can have a blood clot that goes to your hand.
But that's not going to present itself the way one that happens to your brain is.
That's right.
And so you as a vascular neurologist deal with all types of strokes that way. How is it different than a bruise?
So you know what's interesting? I actually sometimes describe it as a bruise to the brain. But what really happens, more unfortunately, is that when that oxygen and nutrients are cut off from the brain, that part of the brain, those brain cells start dying quite quickly. And so then whatever that function of the brain was starts to deteriorate. If it's moving your right hand, you won't be able to move your right hand as well.
I see what you're saying. Okay. All right. So now we can get into the demographics. Why do women have strokes more often than men?
Yeah, so a lot of different risk factors that are similar to men, but in general, women live longer, and stroke becomes more increased prevalence as you get older. And so about 55,000 more women than men in general will have a stroke in a year.
Oh, wow.
And so it does become more common in women, which is surprising for a lot of people.
So does the type of stroke like how'd you say, the
hemorrhagic,
is that more common as you get older because our walls of our veins and things get thinner, or do they both happen just as frequently?
They both are similar in how often they happen throughout a lifetime.
Okay.
And in general, for strokes, about 85% will be the ischemic stroke, so the blocked pipe.
Okay.
And then the rest will be the burst pipe, the hemorrhagic stroke.
So let's talk about the ischemic.
Yes.
How does a pipe get blocked? What is it getting blocked with?
Yeah, that's a great question. So a lot of times blood clots can form in the heart, for example, from a risk factor called atrial fibrillation. So atrial fibrillation is a disease of the heart where it's not beating to a drummer that we understand. It is beating irregularly. And when that happens, if blood sits in the heart for longer than it was meant to, it can form a clot.
Oh, wow.
Then when the heart pumps, that clot goes up, goes until it stops. If it finds a pipe in the brain, it'll stop where it stops. And then that's when the damage happens. So that's one way that you can have a stroke for a blocked pipe.
I see.
And then some of the other ways are, as we get older and then depending on how healthy your lifestyle is, you can have what's called atheroma plaques. And so to break that down, that medical
sounds like
word.
a Greek hero.
It's not a hero. It is a villain. And so that villain will sometimes break apart from, for example, arteries in our neck, where you can have that plaque build up, and that can go up and block a pipe as well.
And is that from things like cholesterol?
Yes, cholesterol plays a big part in that. And then it also happens just with general aging that we get these types of buildups in our body.
Are there more, because just like you're thinking on roads, there are more places on roads that tend to bottleneck and you get like a pooling of traffic. Are there places in our body that you see strokes more often?
Yeah, so usually strokes more often happen in what we call the front part of the brain, the anterior circulation.
Okay.
And so the big two pipes in the front of the neck here called the carotid arteries that take blood up to the neck. Throughout that piping system, you have more often blockages than in the back part of the brain.
Oh.
But in the back part of the brain, when those blockages happen, obviously they're also catastrophic and can be very dangerous.
Oh, yeah. I'm surprised that these clots form in the heart with the fibrillation. I mean, no, I just slurred that a little bit, but you know what I'm trying to say.
Yes. AFib.
AFib. Yes.
There we go.
There you go. Yeah. I'm surprised that, I mean, how irregular is this heartbeat? I mean, it seems like these clots can form extremely quickly.
They can. It can form very quickly. And one of the challenging things is that atrial fibrillation, most people don't feel it. It is something that you have to think about and ask your doctor to potentially be screened for. For example, over the age of 75, there are more women than men who have atrial fibrillation. And so keeping that in mind, and if you do feel like I have some palpitations, asking your doctor about that, having your pulse checked, asking for an EKG, those kinds of things are very important, because if you catch atrial fibrillation, there are medications, blood thinners that can help prevent a stroke much better than aspirin, for example. And so knowing about it and asking about it is important.
Oh, interesting. Okay, well, let's talk about symptoms of stroke real quick. And we'll get back to the healthy lifestyle, because I'm not letting you off the hook there on that one. So I've heard that, slurred speech, confusion. What are the symptoms of a stroke? I'm assuming there are more than those two.
Yes, absolutely. So when we educate on stroke, we like the people in the world to know about some key main symptoms.
Okay.
And so using the acronym Be Fast is helpful. And so the B stands for balance. If all of a sudden you're trying to walk and you can't walk, you're tilting to the left and you can't understand why, you're just not able to walk, that could be a sign of stroke.
Okay.
If you all of a sudden are seeing double, your vision is gone, you can only see half of your world, that can be a sign of stroke. And so that's the E for eye. F is for face, and that's a common one people kind of think of is your face drooping. And so that's one of the other signs of stroke. A is for arm, and so if your arm, you try and lift it up and one arm is not going up as high as the other, something's wrong with your arm, that's a sign of stroke.
Okay.
And then S is for speech. And so if you're all of a sudden not able to talk well or not able to understand what people are telling you, that's a sign of stroke as well. And then the T to wrap out the Be Fast is time. And so calling 911 is incredibly important. And one of the big take-homes is if you try and get to the hospital yourself, you will delay your care. Calling 911 helps because EMS starts blood draws, they start a line, and they also let the ER know you're coming, and ER will be set up with the doctors waiting for you when you arrive.
But if you are confused, how are you supposed to call yourself? Like, I mean, I'm assuming that's in that moment, because how often have you perhaps had low blood sugar? And you feel a little disoriented. Should I call in that moment and say I might be having a stroke? Or, I'm thinking about it in my real life terms. If I would have the cognizance to say, this is probably a stroke, especially if you're confused in that moment.
Yeah, what's interesting is that confusion is one of the symptoms that women complain of more than men. And it makes it more challenging.
It's because men are always confused.
yes. So that's their baseline. Yes.
I'm just kidding.
No, it's okay. I don't think we're here to determine who's better, men or women.
No,
but
definitely not.
If something comes out, that's fine. But with the confusion, that's very challenging. And so if you live alone, it's more setting up systems of support so that does someone check in with you regularly? Those kinds of things are important.
Right.
But otherwise, as a family, or if you live with other people, you're going to be relying on them really to recognize these signs and symptoms of stroke in you. So if your loved one's confused, look at their face. See if it's drooping. Try and ask them to hold their arm up. Try and ask them to talk, and then call 911 if those things are not going well.
And if you're able to, and you feel confused, go look in a mirror and try those things.
Absolutely. And you'd be surprised that even through that type of confusion, it's not an all or none. It's something's off.
You just don't feel quite right.
And the good and bad thing about stroke is stroke doesn't tend to hurt. And so we find that most people will feel off and try and rest at home.
Right.
And that's dangerous.
Yeah, because I've always heard time is of the essence.
That's right. Time is brain. And so resting at home is not something you want to do. You want to try and look in the mirror, look at your face, raise your arm up. And if you're worried at all, calling 911 is appropriate, getting the help you need.
It's better to be safe than sorry.
Absolutely.
Yeah,
absolutely.
For sure. For women, are there any unusual symptoms that men don't tend to have?
Yeah, nausea is one of them, fatigue. And so I say that with a bit of caution in that if you're only nauseous or just fatigued, I think your body.
Yeah.
And you know when something's different. And I think using that internal radar is very important. But if you have any other of those signs of stroke also, then don't think that it's just the fatigue is something different, is something normal.
Right.
Don't think the nausea, I must have just ate something bad.
Yeah.
Those can be signs of stroke. So coupled with the be fast that we ask people to recognize as more clear signs of stroke, knowing that women may be a little more confused, a little more fatigued and nauseous, and that doesn't mean they're not having a stroke.
Okay, so that's the only other extra one for women. I wonder if it's along the lines of heart attack in women, whereas the atypical are only called atypical because we never studied female bodies.
That's right. And we know females have been underrepresented in research and literature and are trying to be more recently.
Thank God.
But it's been decades.
Yeah.
For women, the common traditional risk factors for stroke, similar to men, are going to be most important throughout their lifetime. Okay. And we can talk about some of the other unique risk factors for women that do increase the risk of stroke. But if nothing else, you want to focus on those traditional ones. So high blood pressure, high blood pressure, high blood pressure.
Interesting.
I say that 3 times because if I was given a magic button to cure one ailment in the world, it would be high blood pressure.
Oh, interesting.
That downstream has so many effects.
Oh.
So high blood pressure is the number one risk for stroke. It's, worldwide, that's the number one preventable risk.
What is it about high blood pressure that causes stroke?
So it's the wear and tear on the pipes, on those vessels. And so if you can imagine a hose, this is sort of the analogy I like to use with my patients.
Sure.
If you're going to run that hose at full force 24/7, eventually it's going to collapse on you. It's going to potentially burst, and it's not going to work. And so the vessels take that strain of high blood pressure, and it can cause stroke in so many different ways. And so high blood pressure is one of the main risk factors to think about. And if your doctor says they're worried about blood pressure in you as a patient, I would spend as much energy as possible trying to
get rid of that. Yeah, do what you got to do.
Yep. And then, of course, we have diabetes, high cholesterol, and smoking is a big risk factor as well.
Okay.
And then atrial fibrillation, the AFib that we talked about, especially as you get older, that's one of the ones that can cause some of the most devastating strokes.
Okay. And how about for women? What are the specific risk factors in women?
Sure. So for women, what's interesting is that younger women, I think, need to be more aware of stroke than men.
Are you seeing it more in younger women now?
Yes. In general, I feel like we're seeing stroke in younger patients more often than before.
Does stress have any part to do with that?
I think so. I think that because stress doesn't help us take care of our other illnesses.
That's true.
And I think that's one of the main reasons, but also stress in and of itself. But for women, especially young women, pregnancy is a unique time when they can be at risk for stroke.
Okay.
Using oral contraception is another increased risk for stroke.
Especially if you smoke.
And especially if you smoke, yes. If you're going to be on an oral contraceptive with estrogen, you really got to quit smoking. And your doctor has to think twice before putting you on that.
What is it about? Does the smoke attach to the estrogen? Why do you? I mean, I don't know if you know the answer to this, but like if you're taking a birth control pill that is estrogen, progesterone, what is it about smoking that makes it so dangerous?
Yeah, that's a good question. I can't say I could answer that exactly, but we know smoking by itself increases risk of stroke. And then we know that oral contraception, especially estrogen-based contraception, increases risk of stroke. And when you combine risks, they really accelerate.
I see.
And so that's something that happens.
I see. Okay. And how about hormonal changes in women?
Yes, that's a good question. So the other time in a woman's life where you're at increased risk of stroke would be potentially postmenopause, especially if you're using the hormone replacement therapies.
Oh, great.
Yes.
Yeah, just one more thing to tack on to that postmenopausal time in life.
Yes, I always think it's interesting that you could be at increased risk of stroke if you're using the birth control, but then also at increased risk of stroke if you're pregnant.
Yeah.
So
there's just no winning.
You could be in one of those states at any point.
How about alcohol? Does that do anything? Does that, smoking causes an increase. How about alcohol?
Directly in and of itself, alcohol is not necessarily linked with stroke, but alcohol increases your blood pressure. So again, a lot of times people find that if they are drinking in excess and they cut back their blood pressure, they may even get rid of one blood pressure pill. So that's one of the ways where we know that consuming too much alcohol will increase your risk.
That makes sense.
And sort of by causing high blood pressure.
Well, and you're talking about the one with the blockages that cause the stroke. Ischemic, is that right?
Ischemic.
Ischemic. I was close.
Yeah, that was right there.
So I have low blood pressure from time to time. Is that at all a risk factor?
It can be because we know that it's all about getting the right amount of blood to the brain.
Yeah.
And so if you're low enough where you're passing out, that would be problematic.
Okay.
Especially if we talked about having some of that plaque in your pipes.
Yeah.
So now,
neck.
yes. And so I know this is a piping podcast now. We're just,
I sound like I'm talking to a plumber.
Yeah,
but
we're plumbers
fine.
here. We are. And so with if you have extra plaque in your pipe and it's already tight, then you can imagine that if your blood pressure drops too low, that'll take away the blood that the brain needs.
Yes. That makes sense.
But in general, low blood pressure, if you're able to walk around and function, is great.
Okay. Well, that's good.
Yeah.
So if you're walking and everything seems fine, I'm here. Yeah, I don't have it all the time, but every once in a while I'll stand up and I'll feel real woozy.
Right.
And I have had numerous doctors tell me that I have low blood pressure.
Okay.
Just a fun fact about me. So let's talk about the healthy lifestyle.
Sure.
So I'm assuming, before you answer, that's probably got something to do with lowering your blood pressure. So I'm assuming exercise is in there.
That's right. That's right.
So what other things can we do to lower our risk for stroke?
Yes. So one word about the exercise is that I have so many patients say, Doc, I am on my feet all day at work.
Oh, yeah.
And I get that. And it's good. It's not, not being sedentary is important. Being up and active, walking around is very important.
Okay.
But you really got to have that time in your week where you change into exercise clothes and build up a sweat. Moderate exercise. And so you want to do that at least 4 or 5 times a week for at least 30 minutes. And that's quantifying it, because sometimes people think they're getting enough exercise because they're active at work, and it may not cut it.
Yeah, you need a sweat.
That's right. You need to just build up a sweat.
Okay.
And so that's one thing. Then also eating a healthy diet.
Okay.
And one thing that's been studied in stroke is something called the Mediterranean diet.
Oh, yes. It's very popular.
Yes. You know about all about this.
Yeah.
And so that's one thing to think about. And so I'll often tell my patients, when you're looking at your plate, half of it should be vegetables and fruits. Really a vegetable heavy, plant heavy diet is very good. But people like to eat meat as well. But when we look at our plates, it really is only about a quarter, 25% of that plate that should be lean meats, seafoods is probably going to be the best thing for you.
I'm hearing all these vegetables and fruit talked. Is that because it's got fiber?
I think fiber has a good role in it.
Fiber's awesome for a lot of things, and the more I hear about it, I'm like, I don't know. It makes me wonder if this is going to help in this case as well.
It is. A good fiber in there, good whole grains, all those things. I think it's the sort of synergistic effect of all these foods together.
Yeah.
And then really paying attention to those portions and focusing a little more on vegetables as much as we can would be good.
So we know that when you've done the Be Fast and your arm isn't raising, your face is drooping, you think you're having a stroke, you should definitely not drive to the hospital.
Right.
And can you just reiterate why that is?
Absolutely. If you call 911, the paramedics are going to recognize the symptoms. They're trained in it.
Yeah.
And they can also recognize mimics and say, actually, this might be different. Maybe you had a seizure.
Maybe
something
it's Bell's
different.
palsy or
exactly.
something. Yeah.
And then when you're en route, they'll be placing an IV, drawing blood that's needed to go to the lab emergently. And as soon as you get to the hospital, there's a team of doctors waiting, team of doctors and nurses waiting to really act fast and get you the medication you might need.
And how is a stroke diagnosed once you get to the hospital?
So it's through that exam is a very big part of it.
Okay.
And so at WakeMed, for example, we have a whole team of doctors that'll meet you. We actually have a stopping place in the hallway because this is how important it is to go fast.
Yeah.
They stop, they do their exam, they take a quick history to find out, when did this start? When were you last normal?
Yeah.
When were you really feeling fine?
Yeah.
And then they'll call the stroke doctors, talk about that, and the stroke doctor does their evaluation after you get out of the CAT scan. But they go straight from the hallway to the CAT scan because, again, time is brain.
Yeah.
And if they have the opportunity to give you a clot-busting medicine to break up that clot, that's something you're going to want.
So you keep saying time is brain. What happens when your brain doesn't get enough blood?
So every minute, about 2 million brain cells die without blood. And
you can lose speech, that kind of thing?
Absolutely.
Okay.
Absolutely. Speech, movement, balance, all those things. And as another example of I think sometimes this example helps me a little bit more, is that the ischemic brain ages about 3.6 years every hour that you don't get treatment.
Oh, wow.
So sitting at home for that hour trying to figure out, is this really a stroke or am I going to just be fine? It can be really detrimental to your future and your health.
And you'll lose all these abilities. How interesting.
Yes.
So how does a stroke in the brain differ? Because you mentioned the bursting kind, the
hemorrhagic.
I'm the worst.
No, you're fine.
Typically, I can get these words. These words today, you're winning. How does it differ from an aneurysm?
So that's a great question, because a lot of people say I have an aneurysm, and they may mean I had a stroke where I bled.
Right.
They actually may mean I had an ischemic stroke, a blocked pipe. So again, these words get very confused in the general public. But what an aneurysm is when the blood vessels are weak and they form a kind of bubble. And that outpouching. If you look at a picture of an aneurysm, you'll see sort of a normal pipe, a little balloon-like area, and another normal pipe.
Okay.
And so that's at risk of bleeding and puts you at increased risk of a bleeding type stroke.
Okay, gotcha. All right. I'm going to do a little myth busting with you right now.
Okay.
Are there assumptions people make about strokes or stroke symptoms that are really dangerous? Assumptions. What people... like just myths you've heard that people say about stroke that just aren't true?
Oh, that's an interesting question. I think that the biggest assumption is that things are going to be fine, and so staying at home.
Yeah,
and
you can sleep it off.
And sleep it off is one of the biggest problems.
Yeah.
That I think of. One of the other, I think, assumptions that keeps people from really worrying about stroke in a way that we want them to recognize, because just like heart attacks, which have gotten a lot more publicity and education out there, this is a life-threatening illness. I think people assume that a stroke is going to sort of end your life, but actually the disability is one of the more devastating parts of it, as well.
Is it more common for that than death? Getting the disability side, like this,
Yes.
the most severe of strokes leads to death, I would assume.
That's right.
Yeah.
But the vast majority of people can survive the stroke, but then you're stuck with disability. And so, that's another myth. And one of the other myths that sort of builds on that is that I've had a stroke, I can't move my arm or leg, and that's going to be permanent. I would say that's not true.
Oh, that's good to know.
Yes, there is healing. The brain tries to heal. It really does.
Okay.
And so you'll with therapy, with aggressive therapy, and taking medications to prevent another stroke, you can get better. And so, you may not go back to 100% depending on how severe your stroke is.
Sure.
But there's lots of survivors out there who've had a stroke and made a full recovery.
Well, that's wonderful.
As well. So to give that, because depression is very common after stroke as well.
Of course.
Just like with heart attack.
Yeah.
And so knowing that there's a lot of patients in the bed when I see them in the hospital who say, oh, this is it. This is how I'm going to be. And that's not true.
Oh, that is great news. Is it true that neurons, I've learned this a long time ago, and I don't know if it's true, so I'm going to ask you, that neurons can't regenerate?
That's correct. They do not regenerate.
Okay, so when you lose neurons, which is what I assume when you mean time equals brain,
right?
You're not going to be able to get those neurons back, but yet you still can, the brain can heal.
Right. So that recovery comes from sort of neuroplasticity. So really the surrounding neurons try and do their best to take over the tasks.
Oh, kind of like every office after the pandemic.
That's right.
You lost all these employees and everybody's trying to do everybody else's job.
That's exactly right.
For the same amount of money.
That's exactly right.
Okay.
That's exactly right. So you can see where a complete recovery sometimes is hard.
Yeah,
but it can be done.
Okay, that's good to know. My mom had mini strokes a while back.
Okay.
What exactly is a mini stroke?
Yes. So mini stroke is usually synonymous with something called TIA, or transient ischemic attack.
Okay.
And another term people use for it is pre-stroke. And so
I don't like the thought of that.
Yeah.
Go ahead.
And that's really what it is a warning sign.
She changed her lifestyle, and it was probably 10 years ago, so
I'm
hoping she's good. But so it's like a tremor before an earthquake.
That's right. And if you think about what's happening in the brain, it's that a pipe is going on to be blocked. It's almost there. It's struggling. And so people may say, oh, all of a sudden I couldn't move my hand for 5 minutes, and then it went away because there was a pipe there that was about to be blocked. Had it gone on to completely stay blocked, you would have then had a full stroke. Correct. So it's a warning sign.
Oh, wow. Okay. What's the overall thing you want people to remember when they see the signs of stroke?
Call 911.
Okay.
Yep. That's I think the main message for how to get yourself the treatment, because one thing that I want to mention is that when you get to the hospital, if you get there in time, within 4.5 hours of when the stroke would have started, there's a clot-busting medicine that you can receive.
Oh, good.
That really improves outcomes.
That's
It's
wonderful.
really important. But less than 10% of people reach. Less than 10% of people reach there in time to get that medicine.
Wow. 4.5 hours is a long time.
Yep, but you can think about people
I always thought it
sleeping
was
off.
minutes. I always thought, I'm sorry, I'm just shocked. I always thought that you had mere minutes in order to like recognize it and be en route. But 4 hours and people still aren't making it.
Correct.
Wow.
And that's funny that you say that. I think 4.5 hours is not enough. I wish we had a medicine that we could give even more.
Yeah, obviously. but from what I had gleaned off of what I'd learned through media and elsewhere, I thought it was a much shorter time.
Yes, but you're right that every minute's important. We talked about how much you age every hour that you go without treatment, every minute. But that clot-busting medicine can only be given to you if we find that time within 4.5 hours of when it started. And then there's another treatment that's a possibility. If you have one of your larger pipes blocked, one of the ones that can actually be reached by a tool, you can get that clot pulled out.
Okay.
And so that's the other important thing. And that's why I say call 911 is that you have these therapies, but there's a finite time after which point you can't get them.
Yeah. Better be safe than sorry.
Yep.
Like, call them if you're worried. Just call them.
Yes.
Just call them. It's fine. All right. Well, thank you so much for your time today. This was super informative. And if you live by yourself, and I'm looking at you, Mom, because I know you listen sometimes, you think you're having a stroke, go look in the mirror. Go look in the mirror, try to raise your arm. And if you have to hold on the wall to get there, it's time to call 911.
Right.
Remember, be fast. Balance, eyes, face, arms, speech, and time. Don't wait it out and try to sleep it off. Call 911. My guest today was Dr. Chandni Kalaria. To find out more about WakeMed's stroke program, go to wakemed.org and search stroke. If you have a question you'd like me to ask or an idea for a future episode, well, go to WRALFM.com/Sarah Has Questions. We would love to hear from you. Links to both sites are in the show notes. Okay, remember, be fast. See you next time.